Hey there guys, welcome back. Dr. Edrich here, Heritage Hills Addiction Medicine and Mental Health, coming to you from the tallest church cathedral in the world, in Ulm, Germany. You can look it up, it's fun. This is my Stairmaster workout for the day. Naltrexone versus Naloxone. This keeps coming up over and over. It's very simple. They're not the same. Everybody keeps thinking they are, but they're not. They are actually two different compounds. There is some similarity, but that's where it ends. You guys know of Naloxone, Narcan, as the medication that we use for rescuing. So Naloxone, the medication we use to rescue people from overdoses, is the one the paramedics will generally inject, or it's the one that you guys buy nowadays over the counter at the store, at the pharmacy. Again, Narcan is for rescue purposes when people overdose. You guys know that. So, people ask me, why is there Narcan, an anti-narcotic Narcan, Naloxone? Why is that inside the Suboxone medication? Why is it built into that? What's the purpose of having an anti-narcotic built in with a narcotic? Here's the answer why. Naloxone, Narcan, when taken orally, does not absorb into your bloodstream. Hope that makes sense. You put Suboxone, which is two medications, buprenorphine mixed with the Naloxone anti-narcotic. When you put those together and you stick it under your tongue, the thing that absorbs is actually the buprenorphine. Naloxone does not absorb into your system from under the tongue or in the stomach. Basically, you just poop it out. So then why the heck do we put it in there? Okay guys, I reached the bell tower, about halfway up the cathedral now. Let's take a listen to these real quick. Obviously you won't be able to hear me. What you're going to hear is 4 higher tones, 1 for each 15 minutes, and then 3 lower tones because it's 3 p.m. Okay, now that our ears stop ringing, so what's the point of putting Naloxone into the Suboxone? The point is to protect me, okay, and you, from accidental misuse. What do I mean by accidental misuse? That means sometimes when people are used to doing IV drugs, like heroin, they will accidentally use Suboxone as well. So when you use Suboxone intravenously, the Naloxone actually becomes incredibly active, and you will go through the most amazing withdrawals ever. Now, again, when you take Suboxone as prescribed, just orally under the tongue, the buprenorphine alone absorbs, and the Naloxone does not absorb at all. It just goes away. It's only if you take the stuff IV that it becomes an opposite, actually. It will give you the most amazing withdrawals. Alright, let's tackle the next step of the ascent. This is 740 steps up, about 530 feet. So if you don't belong to a gym, this is an excellent way to get your exercise. So the reason you want to be protected from your own standpoint is because of the history of IV use. Suboxone is a medication that you take sublingually. It absorbs slowly, keeps the brain on lockdown, and it reassures us all, medical providers, as well as patients, that there's a very little chance of the medication itself being abused. I just realized that this video would have been a lot easier to film going down instead of up. So we all know the protection from the naloxone component goes both ways. It protects me because I know I can send you guys home with a great medication that will help lock down your brain, while the 9 or 12 months allows the receptors to sort of go away. And at the same time, I don't really have to worry about you guys injecting the staph IV, because it gives people severe withdrawals at best, and at worst can do a lot worse than that. So it is useful that way, and that makes it a very, very useful medication to sort of lock your brain down. It's kind of like the airbag in your car. We hardly ever sell cars without airbags. Does that mean we don't trust people's driving? No, it does not. We trust them. But if anything hits the fan, we don't want people driving cars without airbags, basically. And especially people with bad driving records, okay? Histories. And the same with Suboxone. We don't want people taking the buprenorphine without the naloxone component, because that's the airbag. You'll never see it. It'll never cause any problems unless something bad happens, and then it pops out. So that's where the protection comes from. One last detail about naloxone. Narcan. Again, naloxone is the generic version. So the difference between naloxone and naltrexone. Naltrexone is the pill version that we give people to help reduce. It's also an anti-narcotic. That's the one we give people to reduce alcohol cravings, opiate cravings. It comes in the injection version called Vivitrol, which is also helpful. We'll talk about Vivitrol a little bit next. But for the most part, naltrexone is the oral version, and naloxone is the IV or injection version, with the exception of Vivitrol. We'll talk about that one, guys. Anyway, signing off from the more than halfway up the Münster, 530 feet. Probably keep talking upstairs at the next level.